Welcome to the second Virtual Voices webinar. First, I would like to thank all of you for your notes and your suggestions. And we would like to ask you to continue because it helps us with our future programs. Our speaker today is Dr. Bernhard Goldstein. Dr. Goldstein was the chair of the first United Nations conference that we had in 1992 on the topic of health and environment, global partners for global solutions. This was just before the Earth Summit in Rio de Janeiro. Dr. Goldstein has been on our board of directors since that time. Our moderator, Apurv Kabir Gupta, who has innovated this sharing program with all of you, will now continue. Apurv, you have the stage.
Thank you so much, Dr. Durbach. Bernie, it's great to have you. As Dr. Durbach mentioned, Dr. Goldstein has been an integral part of the WIT family, the WIT community. He's addressed our interns multiple times on important environmental health issues. He has been a member of the US National Academy of Sciences. He was also the US EPA's Assistant Administrator for Research and Development and has been involved in broad issues in environmental health since 1960s. Today, Dr. Durbach and Dr. Goldstein will present their voices, if I would say, on these very important issues. So, Dr. Goldstein, over to you.
Well, thank you very much, Apurv, and thank you. It's just great to be here and to see a few of you, all looking young. Although I see William Rahm's name, Bill, I know is going to probably have the same white beard I do at this point. In thinking about what to say to you, using a virtual approach, which we've already had our first crisis with this morning and managed to solve. You see, my name is Russell Carruth. It's not. We somehow couldn't find me this morning because it turns out my wife, Russell Carruth, who I love dearly, last night did a Zoom conference on this laptop, and she must have hijacked my name or something, or the Zoom program that I'm working on, so that we couldn't find me this morning. I'm going to talk about problems to be solved. I decided really that in thinking through this talk in more detail in the past week, that this audience understands ecological balance. They understand that we're part of an ecosystem, that we humans are ever since our first agricultural days, are disturbers of ecosystems. I mean, that's what agriculture is, basically. You disturb an ecosystem to do what you want with it. And that we're the major problem. And so I thought, given a relatively young audience, that what I should really be doing is talking about how to challenge you, about what the challenges are, and about things that worry me that go well beyond the current day's thinking about where we are and where we have to go. One approach is to basically talk about what are really two existential problems to this, to humans on this planet. One obviously being global climate change, but the other being COVID-19. And to use an old-fashioned pedagogic approach that I suspect you've all been subjected to from the many countries you're from, that you've all been subjected to sometime not just sometime, but from the time you were in elementary school, which is to compare and contrast, and to see about if we can get ourselves thinking about what it is that is really similar about global climate change and COVID-19. Both obviously are existential threats. Both obviously have different causes. If we go and we start looking at what are the specific causes, how could an infectious disease and a change in our planet be considered in the same light? But if you start thinking more about them, you understand that there are issues that are similar. One is the issue of resilience. We talk a lot now about resilience. It's a favorite word. We're talking about how the planetary resilience, community resilience, a resilience of individuals. Let me see if I can put those two together. Put together the two existential challenges. If we talk about global climate change, one way of describing it is a loss of planetary resilience, a planetary buffering capacity. We in the United States, we used to have a Midwestern states that were absolutely full of trees. Trees from the border of Pennsylvania all the way to the border of Illinois when the prairies began. Within a very short period of time, perhaps 60, 70, 80 years in the 19th century, we cut down almost all of these trees. The impact of doing that on the global climate was probably minimal, if at all. Maybe some local, I'm sure some local climate changes, tearing down all those trees. Because the planet had the resilience, had the buffering capacity to be able to deal with the fact that we lost all those trees. If we tear down all those, the same amount of trees now in the Amazon, we no longer have that buffering capacity. If we don't have that buffering capacity, what it means is that we do have global effects where we didn't have it before. But on the other hand, is it fair to the folks in Brazil to say, oh, no, you shouldn't cut down your trees, even though we in the United States and in other countries have cut down ours? So that is quite a challenge when we talk about what we mean by resilience in terms of how to spread that resilience around. What is it that we deal with it? We talk about sustainability a lot too. And let me see if I can put the difference between sustainability and resilience into context. One of my favorite definitions of sustainability comes really from engineers. It's from the expression about whether or not a glass is half full or half empty, with the optimist saying it's half full and the pessimist saying it's half empty. From a sustainability point of view, the glass is really twice the size it needs to be. A sustainable world, we're going to have to be as efficient as we possibly can. And so we've got to cut that glass down to size. But wait a second, what about resilience? I mean, if the water is, if we're ever going to carry that glass and my hand tremors just a bit, I mean, I'll spill it if it's filled to the top, if it's half the size. A lot of the global climate change issues we're talking about is basically challenging the size of the glass. For resilience sake, the glass has to be larger than just a sustainably sized glass. How much larger? Well, we really haven't dealt with that directly. What we do is we go at that indirectly. We go at that bit by bit. And we need a much more comprehensive, sustainable, if you will, approach to what we mean by resilience. How much resilience is necessary to be able to have this planet keep functioning the way it is, to be able to have we humans have our, if you will, the role we've taken on this planet, or whatever role we want to assign ourselves for the future. So we need to think about global climate change as being something that affects the extent of resilience we need, the efficiency with which we can function. Well, what about resilience in terms of COVID-19? A human body, to me, I'm a physician by training, a human body is much the same in many ways as these planetary processes that we can talk about. As we age, we lose our buffering capacity. It's as simple as that. We lose our resilience. All of our organs, our major organs at least, once we get past young adulthood, they all decrease slowly year by year by year as part of a normal aging process. That normal aging process really is a loss of buffering capacity. And when it's challenged, as COVID-19 is certainly challenging our lung, our heart, our kidney, it seems, the buffering capacity is not there to deal with it. If you get an infection that's localized to the lung and you're a young person, your other organs are sort of almost walled off from the impact of that infection in one organ. But now, when you get to my age, that wall no longer is there, that resilience is gone, that buffering capacity is gone. So again, we can think of those in roughly the same way. And it's no surprise that something that affects our lung increases our likelihood of dying when we have lower lung capacity. And it could be from age, it could be from a previous illness, it could be from someone who has a lung cancer in the past that had the cancer successfully removed, but she lost 2 lobes of her lung. That puts her at greater risk as well. When we deal with these risk issues, we need to understand all of the interactions. For instance, we recently have our current administration in the United States has put forth a standard for fine particles. Fine particles are those air pollutant components which are particularly harmful to the lung and to the heart. This was put out on April 30th, I believe it was, just a short time ago. The standard is not going to change, but our standard setting process would seem to argue that it should change. It should get to be more stringent, a tougher standard based both on new science, but based very importantly on a common sense approach that Congress has put into our US Clean Air Act, and that's called the margin of safety. Well, a margin of safety is there usually because we don't understand completely all the potential effects. And if you look at what Congress says that the margin of safety, how the margin of safety should be set, first of all, it says it's not for scientists to set, it's for a policymaker to set. So it's basically up to the policymaker because the standards, the factors that are used to set it, according to Congress, are 3 very common sense standards. One is how risky is it? What are the potential consequences from not knowing something? Well, the fine particles affect the heart and lung. COVID-19 affects the heart and lung. We don't know how much effect COVID-19 will interact with fine particles. We know fine particles cause loss of lung function over time, that people who live in areas with high levels of fine particle air pollution don't have lung function as they get older, the same as people who live in more pristine areas. That should put them more at risk from COVID-19. From what we understand of aging, the process of losing function puts you more at risk to a challenge on that function. Well, again, why shouldn't we be considering margin of safety factors for COVID-19 with our new air pollution particle standard? What other common sense factors should the administrator take into account? And this is true in any country, but I know the US was, so I'll use that one. Well, not only how bad the effect could be, and obviously death is a bad effect, but how many people are at risk? Well, all of us who are old at risk, and anyone with pre-existing lung or heart disease, and a good figure is probably 15 or 20% of the US population is at risk. And actually that risk is going to be increasing over the next 5 years before we consider the standard again, just simply because of the population bulge caused by the baby boom. And the other one is, well, what are the factors that figure into the uncertainty? How uncertain are we? And wow, we're pretty uncertain about how long COVID-19 is going to last, whether it's the new normal, as a World Health Organization leader recently said, whether we will achieve herd immunity, whether a vaccine will work well, or whether our own immunity once you have COVID-19 means you're spared for it lifetime, or is it like other coronaviruses which cause the common cold where the immunity lasts months or still a relatively short time? We don't know any of these things, so the uncertainty is great. So we ought to have a margin of safety that includes the COVID-19. Well, somehow on April 30th, just a short time ago, when this decision was not promulgated, was proposed in our Federal Register, COVID-19 was not considered. So there was unwillingness to go beyond the the very narrow constraints of a usual process to consider just the science related to fine particulates in air pollution, and not consider the fact that long-term effects to air pollution causing loss in lung function will put people more at risk to COVID-19. So we need to be able to put these different pieces together of our environment, and we're clearly not doing it. EPA does mention COVID-19 in its Federal Register notice about it. It mentions COVID-19 as a reason for closing its public library. So you'll have to download the announcement. You can't go get it by going into EPA. But otherwise, it doesn't mention it whatsoever, which makes no sense to anyone thinking broadly about these issues. Well, what are the other interlinks between COVID-19 and global climate change? For years, and I think I did this at a WIT meeting one time, I showed some slides I've been showing to my students for years, in which I start off by asking the question, why is it more likely that overfishing off the west coast of Africa will cause an emerging infection to hit, and I'll put in whatever city I happen to be in. If I'm teaching in Pittsburgh, I'll put Pittsburgh. For WIT, I probably change that to New York. Why would overfishing off the west coast of Africa have anything to do with an emerging infection? And the reason is pretty simple. There's a literature showing that overfishing off the west coast of Africa leads to an increase in the market prices of fish in the food markets in Western African cities, which leads to more bushmeat hunting. If the price of fish goes up, well, if you go out and find yourself a monkey to kill, well, that's a way of getting protein that substitutes for fish and is cheaper. The folks who published on this, and in good journals, Science and others, are concerned about endangered species. And they have a right to be concerned. We've lost a lot of the fauna of this, of our world, because we've just hunted to extinction plants, and the global climate change will make this extinction even worse. But from the point of view of an emerging infection, that's not the issue. The issue is that as you cut up meat that you've caught in the wild, you're much more likely to transmit, particularly from a monkey, which is, if you will, we're in the same general family as monkeys. It's much more likely to lead to a transmission of infection to a human. And of course, with the global nature of how travel occurs and what we've seen with COVID-19, that infection could easily get to New York or Pittsburgh or anywhere else in the world. So these are related, and we still don't know what caused COVID-19, but again, the suspicion that this is an unusual interaction between human and a species of something in the wild that was brought into human contact in ways that shouldn't have happened. So we again have this sort of interaction. There are other ways that we can think of the interaction. We can think of it from terms of information and misinformation. Gosh, the amount of information that's out about COVID-19 that's simply wrong is amazing. The amount of information that's out about global climate change that is simply wrong is amazing. And the question is the information just wrong because we're too stupid to understand what's going on really, and we really should do a better job at it? Or is it intentional? And I just use the word stupid because that is a word that gets us into trouble, and I wanted to be able to build on that. We've learned in public health that if you deal with folks who don't believe in vaccination and who are going to be part of the major herd immunity issues we're going to be dealing with COVID-19, that the easiest way to make sure that they will harden their beliefs that vaccination is bad is to call them stupid. We have to understand that we've got to do a better job of communicating to the public. And we've done a terrible job on global climate change. Let me just throw one I'll give you a little preamble first. We've learned through the years that if we use fancy words we're okay. If I say to a public audience something about 2378 hexamethyl chicken wire or something, they're going to ask me what that is. It's when I use words that sound like we understand them, but I'm using in a very technically limited way that we get into trouble. A classic one in toxicology is we talk about safety factors. We put factors of 10 on what might happen to a rat as we go from rat to human. We don't mean safety factors, we mean protection factors. Safety has a definition that includes a variant which says safety is zero risk. We don't mean zero risk. What we mean is the same thing as if we're telling you to use a child seat in your car to protect your child. That's a protective factor. If you're going to go head on with an 18-wheeler on the turnpike, the child's dead. We understand that. But when we say safety factors, people don't understand it. People think we're guaranteeing zero risk. Well, consider global climate change. Is it really adaptation and mitigation that we should be using in talking about our approaches to global climate change? Which one really means the primary preventive approach of getting rid of carbon dioxide and methane going into the atmosphere by changing our fuels or by doing other things that mean that the cause of global climate change never gets released? And which one means that that what we'll do is we'll build our walls more strongly to deal with the hurricanes, we'll put on better roofs, we'll increase the sea level barriers along our shores. Oh, well, it turns out that's adaptation, according to the IPCC. Well, okay, but mitigation is used throughout the world, including very much in the United States, as putting up the sea level walls, of changing things. But mitigation, according to the of changing how we are going to be able to adapt, to respond to the global climate change effects. It's secondary prevention. Mitigation is also secondary prevention, but somehow or other it's got morphed into something called primary prevention, what I would call primary prevention, and it is very confusing to the public. I don't know why we use these terms when we as scientists can't even agree on their definition, but yet we do use them, and there are lots of examples like that. We have superb organizations that are involved with non-government organizations such as WIT, but are a little less careful than WIT in how they go about in their approach. I won't mention any by name, but you can pick from the most well-known NGOs who are really concerned about global climate change, want to do a lot about global climate change. But if you look at the United States, for instance, and look at what these groups are talking about, they're talking a lot about polar bears. Well, I like polar bears. Everybody likes polar bears. Nobody could be opposed to polar bears. But I would argue that if you want to do something about global climate change from a US perspective, you have to change the government. And so you got to start thinking about who was it who voted for President Trump? Well, all the people who care about polar bears probably didn't vote for President Trump and won't vote for him in the coming election. So why spend all this time and effort focusing on polar bears? Well, it helps help maybe raise some money through donations. But think of it, who did vote for President Trump? Well, farmers, agricultural folks voted about 60-40 for Trump. Agriculture is at great risk from global climate change. Do we talk about that? Not as much as we should. Military folks, the veterans, people of military families also voted about 60-40 for Donald Trump. But global climate change has not only the direct effects of raising sea level, but it has the very indirect effect, but very important effect, in fact, perhaps the most important effect of starting populations on the move, getting across boundaries where people have never gotten along with each other, starting wars, and our US military, unfortunately, gets involved in a lot of these. Why aren't we talking more about this? And by the way, that's something the military understands. The US military, since Bill Clinton's time, has had funding specified as a global climate, as a climate change piece. I don't know if it says global, but it's a climate change piece of their funding to be able to plan for it. When President Trump came in and a Republican Congress came in with him, a Republican Tea Party member put up an amendment to our Defense Appropriation Act to say, well, we shouldn't be spending taxpayers' money on anything related to global climate change. So remove that piece of the action from that funding from the defense authorization. Well, that got voted down. Even though the Republicans were majority, over 40 Republican congressmen joined with Democrats to vote that down. So that's an issue which could be used, and people do get it, but we don't talk about that. We need to talk more about the kind of issues which will sway people's opinion about is global climate change important or not. And it really is important to me. It's the so what issue that we fail on. So I'm going to bring this down a bit by talking a bit about my own personal experience with global climate change in 1985, or perhaps late 1984, where I lost a battle within the US Environmental Protection Agency as to where funding from President Reagan should be used for our global climate change piece. So EPA, this is now, what, 35 years ago, received funding to do something about global climate change. What should we do? My argument was to put the funds, now I was here in charge of research and development, so obviously I was a bureaucrat who wanted the funding go to my group, but my major argument was, I thought a good one, we should focus on the so what part of global climate change. And so what did not mean talking about parts per million of carbon dioxide or methane or rate of ocean warming or any of those things. They're not so what things until you add, and that means something. We need to talk about what that means more than the so what issue. At the time, the congressional issue was there should be a 1 cent increase in the gasoline tax to pay for global climate change related efforts, concerns. And the idea of the American public agreeing to an increase in the gasoline tax for something which they don't understand how it affects them is simply not going to happen. I try to put the money into, we had a laboratory in Corvallis, Oregon, have it, EPA still has it, which has greenhouses and focuses on the impact of pollutants on basically on agricultural things. You plant corn inside the greenhouse, you put in some, you control the atmosphere, you put in some ozone, you see what happens to the corn. I wanted to put in carbon dioxide, see how it would affect growth. I lost out to the Air Office, which wanted to put the funds into yet another model relating carbon dioxide to temperature change. I can feel my blood pressure still up about that. But it really is, to me, the crucial issue. What are the impacts on the individuals? Because in a democracy, unless we deal with impacts on individuals, we're not going to be able to be effective in making changes. From public health point of view, we talk about primary, secondary, and tertiary prevention. Primary prevention in terms of global climate change means, of course, that we don't have carbon dioxide and methane and other global climate change forcing agents coming into the air. Secondary prevention is that, get into that mitigation adaptation issue I talked about before, is, okay, it's going to happen. Let's go make sure it doesn't really affect us too badly. Primary prevention is don't smoke. Secondary prevention is, okay, we're going to help clean out your lungs or do something to make you breathe better. Tertiary prevention is that you're already sick and we're telling you about how to make sure that your medicines aren't causing effects. we need to be able to focus more on primary prevention if we're to deal with the global climate change. And to do that, we need to convince people that it makes a difference to them, that it isn't just something that we're talking about temperature. And we need to do it in language that people understand. We can't do it in our fancy words as we've been doing it up to now. So let me close on that. I've taken my half hour and hope that you've got lots of questions for me about where to go from here. I did leave out one point that I think we all are aware of that maybe I should put in because I know others, but I know others will be talking about it, and that is the impact on COVID-19 and on global climate change of just simply our population increase. The population increases and just puts people too close in contact with opportunities to get transmission, and of course has had about half the driving force on global climate change. So with that, thank you very much for listening, and I'm going to thank again Harper for having gotten me past the initial problem of not being Bernhard Goldstein on the register, you being able to find me. And again, hope that you'll ask lots of questions.
Thanks so much, Dr. Goldstein. That was an incredible presentation where you touched upon multiple topics. I think in sort of the standard that WIT conferences that we've done at the United Nations headquarters, many that you've spoken on, we've always focused on problems and solutions. So I guess our first question is very much around that. We know that climate change is an extremely urgent problem, one that for which, you know, we have to decrease our emissions almost by 7.6% on an annual basis up until 2030. These are figures by the IPCC. And despite the COVID response and the lockdowns across the world, we're still not hitting that target. In fact, latest estimates suggest that we're only about 5.5%. We're only going to be decreasing our emissions by 5.5% this year. So in terms of just speaking about solution, what would be your take on how do we get to a world that complies with 1.5 degrees?
Well, okay, so let's see. I've now left a half an hour for discussion, and I've now got a question that will take at least an hour to respond to. It's a superb question. It's really the most important question. Well, let me go back to my communication point first, though. The question was posed in terms of a goal, not in terms of the so what kind of issues that I was hoping that we would talk about. The levels are set in ways that are very appropriate scientifically. They're very appropriate in terms of following the change and to see if we're meeting our goals. But what is 7.6, or what does that mean? I mean, you're not telling me that the speed limit is 60 and maybe I can go 65, but if I go 70, I'm going to get a ticket. What you're telling me is that something bad's going to happen, but what does that mean to me? Again, if I want to use COVID-19 as an example, as I walk around my neighborhood, which is a university neighborhood, most of the young people simply aren't wearing masks. Us older people are all wearing masks. Our consequences are much greater. Younger people don't see this as that much of a potential really bad consequence. In fact, I've had young people tell me that maybe I'll get it and I'll end up with I'll get a mild case. I'll end up with a certificate saying I've got it and I can get a job. Again, it's that individual thing we need to get to. But how do we get there? One thing we have to do is we have to recognize that there are real problems with the human wiring. We're wired in such a way that we have reasons within our evolution to be focused on kin, maybe on our nation, on our greater group, but it's a group type of mentality. There's a recent article in Foreign Affairs by a fellow named Robert Sapolsky on This Is Your Brain on Nationalism, where he talks about nationalism, not from the point of view of global climate change, but he talks about it from the point of view of how do we get beyond that. There are many people who think we can. I was at a meeting recently where the chair of our political science department, who is a very liberal person, as are most people who are chairs of political science department, basically was challenged with that kind of statement of saying, well, look, people are just built in to be, in a sense, feeling kinship with others, and you can't just get rid of all borders. And he responded by saying something which I found inane, which was, well, if you can teach people to be toilet trained, you can teach them not to be nationalistic. That's nonsense. I mean, we have to recognize that people are like that. And so how do we deal with that? Well, we have to be able to deal with the people directly, with their issues, and try to put it in that way. I mean, look at COVID-19. Every country's pointing a finger at another country as to being the source of COVID-19, or if only this country would have done things the way my country did, the other, all of us would be safer. That kind of reasoning is awful for COVID-19. That same kind of reasoning is awful for global climate change, and we have a lot of that. You're seeing in Donald Trump a response to a belief by lots of Americans that they're being the patsy for this global climate change. That, well, it's not their fault that they cut down the trees. They were doing what they thought was the right thing to do at the time. And hey, you people in the rest of the world, look at your population increase. We haven't had population increase like that. It's really your fault. We've got to get past that. Now, how to do that? Well, again, talk in ways that the public understands what their potential problem is. Now, that's a platitude because I don't really have an answer for your question. I'm very pessimistic about our being able to meet these goals. I'm very much worried about our ability to be able to do so. And I particularly worry because of the lack of focus on science. We can say we focused a lot on science, but we focused mainly on the science that has, some of the, that is allowable. Let me give two examples of what I mean. One of the most aggressive and important approaches in the United States has been the Green New Deal. Okay, it puts everything under one hat, including the terrible problems caused by both global climate change and COVID-19 related to racism, related to disadvantaged communities being a greater risk. But this approach leaves out nuclear power. I mean, nuclear power is completely free of carbon release. It is a great alternative in terms of global climate change. We have a tremendous cost of developing nuclear power, but we have a lot of nuclear power plants in the United States. I think it's a quarter or more than that of a total electric power in the U.S. comes from nuclear power. And these are basically closing down because of all sorts of problems having to do with lack of financial incentives for them. Give them the financial incentives. Don't leave them out of the mix. Well, but nuclear is bad because we worry about waste. Well, let's start thinking about nuclear waste. Nuclear waste in the U.S., as in lots of countries, some countries done a superb job of setting up a central place for nuclear waste. We try to set one up in Yucca Flats in Nevada, and it's an area where it's a dry desert, and the thought was that it would be almost impervious to this waste. Well, but the waste lasts. Well, these are radioactive for maybe 1 million years. And so Congress said, well, for at least 100,000 years, you had to make sure that this was not going to leak out. That's crazy. Think of it in terms of global climate change. 100,000 years is, what are we worried about in terms of risk? The risk of nuclear waste is primarily cancer. Do you think cancer 100,000 years from now is going to be like cancer now? I mean, we've already decreased the age-specific cancer death rate in the United States by 25% since the nuclear waste issue was considered at Yucca Flat, which is about 20 years ago. That's simply not there. Plus, it isn't for 100 years that the first waste might get out, and the worst case scenario. Well, that means that 100 years from now, you might see an increased cancer risk if in fact it gets out. Well, the population there is about 1,000 people. Let's say it's 10,000 people. The cancer risk of concern set by the Congress was 1 in 100,000 lifetime. Well, with 10,000 people, you'd need 10 lifetimes to get 100,000 people to get one additional cancer. That's 700 years. So one additional cancer every 700 years. Compare that to the amount of people who are going to die because of global climate change, storms, and all the other problems in the next 50 or 100 years. We're talking millions of people versus one cancer in 700 years. That's nonsense. We need to get our act together in getting the science right. And while I'm at it, since I've been beating up on the US, let me beat up on the EU. I mean, the whole issue of the precautionary principle as a way to basically say that, oh, it's evil to do anything with GMO. Well, really, GMO problem is that the Europeans didn't invent it first from an American point of view. There's the idea that we would not that we would rule out something that may be needed in this global climate changing world that may be needed to feed the world because of somehow some precautionary approach is absolute nonsense. I mean, there isn't a scientific organization, a reputable scientific organization, including in Europe, that has ever supported this, but it fits in the European desire for a trade barrier. So they have a wonderful trade barrier, which they can keep out products from the rest of the world that has to do with GMOs and has to do with other agricultural products, primarily from the developed world. So again, we have a whole bunch of selfishness, which is based upon distorting science, that is getting in the way of thinking about how we should be dealing with things. And the U.S. distortion comes out of the fact that the chairman of the leading Democratic senator, the head of the Senate Democrats, was a senator from Nevada, and he didn't want the waste in his state. So again, I've ducked around your question because I don't see an easy answer.
No, I think you've answered some very important parts of it. There's no one answer to how we get to solving the problem, but I think in multiple ways we can address it at the same time. Richard actually has a great question. He's asking directly and not mincing any words. He says, do you think eventually, when climate change really kicks in, that it will in itself greatly reduce population through starvation, war, and such?
Richard, I think that's my pessimism, is that if it does, it will do it through war. It will do it through disease, like COVID-19, and war could be nuclear war. Many years ago, an organization I was part of, basically scientists, committee on problems in the environment, did something called a nuclear winter scenario, where you do end up with an apocalyptic kind of ending, because you end up with countries, just one country drops the atom bomb, the next country does it too. And are we heading that way with the dissemination of atomic bombs around the world? And will the global climate change just make the kind of competition that leads to war more common? You can easily imagine that.
All right. Well, thank you for your answer. I have a strong feeling that that's where we're going to head up when you have as many refugees that there will be, displaced by sea level rise and by crop failures and things like that. I think we're going to go into a situation of great conflict, and I think that's going to unleash powers like China and Russia to finally move in and take over territories that they've long salivated over and so forth. And I see where there's going to be great reduction in world population. Now, having said that, perhaps it won't be enough. I think right now, Edward O. Wilson said, and this was 20 years ago, that we would need 3 planets, Earths, in order to provide the sustainability that we need for all the people we have here now. So even with that reduction, I don't know if it really solves the problem per se.
Yeah, Richard, I agree with you completely. Unfortunately, I think we have that. I would argue that we're producing so much, we're able to produce so much more food now, for instance, than we were when we started talking about this, that some of the projections from the past are wrong. But I worry that, again, about things like GMO and the sort of anti-agricultural approach that we have in many places in the world, in our urban society, where we believe things grow at the grocery store somehow, or that we will end up being in more problem than we have right now.
Hey, can I throw in something here? I really enjoyed your talk a lot. I got to say, you were right on. You really hit the bullseye several times in your talk. But I had a little anecdote that I'd like to share, if I may. I was working with Al Gore out in Cedar Rapids, Iowa, a few years back. And Cedar Rapids at that time had a water stain about 9 feet up on all the buildings in Midtown from a flood that happened like maybe a year before we got there to do our training. And we were there, and lo and behold, the second day into it, a whole bunch of farmers showed up. And they actually came into Cedar Rapids on John Deere tractors and things like that. And they all had their bib overalls on and flannel shirts and shit. And Al and I looked at each other and it was like, what are we in for here? And these guys came in, and the Secretary of the Agriculture in Iowa came. He actually brought them down. He invited them down. And so Al Gore let them on stage. And we had no idea whether we were going to get stoned to death or what was going to happen. But all these guys got up there and they said, we farmers understand climate change. And they all went and told us their war stories about, they couldn't plant that season because everything was still underwater from the floods and all that kind of stuff. So I think a lot of farmers around this country are finally starting to understand it. I just wanted to throw that in there.
Thank
Thanks,
you, Robert.
thanks
Richard, I'll give you.
Richard.
I'll give you a quick anecdote that I told with Gore in the audience. I'm told he recalled it, which was around 1986 or so in a town called Westfield, New Jersey, which Christine knows about. The Garden Club asked for a speaker from our Environmental Institute on global climate change, which I thought was wonderful. So I went there and I gave I thought my best talk. And at the end of it, this woman came up to me and she was very excited by the talk, which of course makes you feel good. And the reason she was excited, though, is that she planted dahlias, and her sister in Maryland also planted dahlias, and they were obviously competing with each other. And her sister in Maryland didn't have to dig up the roots and put them in the cellar over the winter as she did in New Jersey. And wouldn't that be wonderful? When global climate change is going to occur, she won't have to dig up her flower roots. There's winners all over. I mean, my father was a glazier. I had a card in the Glaziers Union way back when. I set a lot of glass. We had some hurricanes hit New York in the 1950s. Well, that was wonderful. I mean, that's triple overtime. I mean, putting back all that glass that got knocked out. There are winners for all of this, and we have to understand and talk to the people who think they're going to be winners, but are actually going to be losers, and get them to change their mind. Anyhow.
Dr. Goldstein, we have sort of one other question, which I think will take us right up till time. In your opinion, and I know you've studied the US most, what would you say is the country that is really having a good and appropriate response to climate change?
It's hard to say without immediately quibbling about, That works well. I mean, I just read something about Iceland doing a superb job with COVID-19. They also are supposed to have done a great job with global climate change. But it's nice when you've got a small, relatively homogeneous population with no borders to speak of except the ocean, and it's very clear what your issues are. I like very much what a lot of the European countries are doing. But for instance, we talked about agriculture. If you look at the European planning for global climate change approaches, you find that agriculture just simply isn't part of it. It's too much. It's something that they want to protect, so that in Europe. Germany, for instance, is I spent some time there as a visiting professor just about 2 years ago. It's wonderful as you drive through Germany to see all of the solar panels, all of the wind farms. You got to look quickly because you're driving at, what, 100 miles an hour? You're driving so fast because that's part of the German culture. They like to have these Autobahns with no speed limits. Well, the figures from the German's own figures is that it's a 13% impact, 13% waste of fuel. And when I looked at their figures and how they derived it, I think they're underestimating it because they're not putting into account the fact that people who are going fast suddenly have to slow down because they've got a car only going 80 miles an hour in front of them. You've got these cultural issues, which every country has. I mean, U.S. certainly the culture of the big space. If you look at living space per capita in the U.S., it's I think 3 or 4 times more than that in the Netherlands, which also has done a lot of really good things about global climate change. How do we get these cultural issues? How do we work with them? Work with these issues to make them not go away, because they're not going to go away, but to change. I mean, we're changing in the U.S. We're not moving as much as we did before. We're developing more of a sense of place. I'm eager to see what the 2020 census says about how frequently we move. We're becoming more European. And with a sense of place, then you become a little bit more protective of your environment, perhaps. We may see changes there. There's actually American young people who don't have driving licenses. Who ever heard of such a thing? So changes can occur, but they occur slowly, and you have to work with them.
And that kind of goes back to your point around communication being so critical and key. But I think we have time for one last question. When we think of certain geographies like India, for example, or many Asian countries, which are now looking to sort of develop as fast as they can, what would be your messages to sort of governments of developing countries on how they cannot replicate the mistakes that you have observed in the US government, and what might be the pathway forward for them?
Well, I did a sabbatical in Malaysia. It's about 10 years ago now, and have been down to that part of Southeast Asia a fair amount since. And I've always been impressed with how the Malaysians have developed and have gone about their development. But one of the problems is that it's so easy for developing countries who are doing very well in many ways, countries like India, to when they face a problem, to blame it on somebody else. And that's just part of that human approach. I've joked that the major advantage the U.S. has in the world is that we're the only country in the world that when we recognize finally that we have a problem, can't just forget about it because we say, oh, well, it's really the fault of the United States. We have to look at our own problems. It's just far too easy, at least from my experience in Malaysia and working with some of the nearby countries, to basically point to someone else, whether it be the US or China or India for that matter. So
excellent.
I'm not sure if that's a definitive answer that's wanted, but I think it's a first starting point. You have to recognize where the problem is that you can solve, without just saying, well, yeah, there's a problem, but if it'll cost us something to solve it, let somebody else, it must be somebody else's fault.
Excellent. thank you so very much, Dr. Goldstein, for that incredible presentation. You've covered some excellent topics. Dr. Durbach, do you have any final remarks or closing remarks for Dr. Durbach?
No, but I was wondering, actually, I was thinking about what Dr. Goldstein said about adaptation or modification. And I think a lot of it has to do with the political system, whether the political system takes any of the scientific knowledge that we have, or it just ignores it and considers how much more manufacturers can produce and how much more people can buy to fill in landfills and chop down forests.
You're absolutely right.
So actually, thank
definitely
you
a lot
very
of
much. No, thank
Yeah.
you very much, Bernie. You have been, as usual, excellent. And as you know, that's why we have worked so long and for so many years together. Thank you.
My pleasure as always. Thank you.
Sincerely, thank you, Dr. Goldstein.